So when it comes to the patient care, so they may keep asking you the questions about the primary healthcare issues. Okay? So where the patient, they come to the pharmacy and they say that, hi pharmacist, I have epigastric pain, hi pharmacist, I have the headache, hi pharmacist, I have severe constipation. So depending on the patient's condition, we have to recommend an appropriate therapy, where the pharmacist must do an appropriate diagnosis. For instance, if it is a headache, then simply we don't give any anesthesia to the patient. So we need to make a proper diagnosis. We need to ask the appropriate questions to the patient, and then we will decide whether the headache is a migraine headache, or is it a tension type, or is it a cluster type of headache. So depending on the conditions, so we have to recommend an appropriate therapy to the patient. So these are the ones that are involved that you need to keep in consideration while preparing for the examination. Okay? And apart from these things, the most important thing that you have to consider here is most of the questions that they ask in the examination will be clinical or the therapy oriented questions, okay, or the practical oriented questions, like how day by day, like in the day-to-day life, a pharmacist here in Australia, so what are the challenges that they come across. Okay, so when it comes to the medications, so those are the things that would be assessed in this examination. So while preparing for this examination, so you also need to keep in consideration about all those facts. Okay. So for more updates about this syllabus or any materials that you need, okay, so always I recommend you to visit the official website of Australian Pharmacy Council.